Hi, I'm Dr. David Wong, and I'm at the CARE program at the 2016 DDW. And we just want to talk about some of the interesting developments that have happened in liver disease, actually over the last few years. And probably the biggest thing is in the field of hepatitis C. You must know that we now have great effective antiviral therapies, and they're actually so good that the Canadian consensus guidelines are completely out of date. And in fact, all research is probably out of date, and we're now into the phase of actually delivering care to patients. And in downtown Toronto, in my practice, certainly all the people with HIV co-infection and hepatitis C have been treated, and I expect that all of my sick patients without HIV will be treated at the end of this year. So where's the excitement in research? It's actually in hepatitis B, which you wouldn't expect because it's such an old infection. We've known about it since 1965. But the great new development is that in 2012, out of nowhere, a group from China actually described the receptor required for entry of the virus into the hepatocyte. So whereas for the last 40 plus years we've never been able to grow hepatitis B in a test tube, we now can. And it might surprise you to learn that if you thought that tenofovir and entecavir were good drugs, most patients would disagree with you and think that they're not so good because they're lifelong therapies. Everyone wants a cure, and there's probably 5 or 6 different cures in the pipelines that are hitting clinical trials in the next year or two. So that's what I'm looking forward to in DDW. And if you want to catch some of this new stuff happening in hepatitis B, it won't be at the abstracts. It's actually a great review by Jake Liang on the hepatitis B session, where he will talk about all these new developments and new therapies for hepatitis B at this year's DDW.